Good morning, good afternoon, good evening, everyone. I hope everyone is doing well. This is a LinkedIn Live event where Priya and I are going to talk about customer experience in healthcare. To be precise, we're going to talk about transforming customer experience in healthcare with hyper personalization. We'll begin in a couple of minutes. Till that time, we'll let a few more people join in. Uh, both Priya and I are joining from Gurgaon. Would be good to know where again others are joining in from. So please do use the chat functionality or the comment functionality to add in where you're joining from. And also, what would you like to talk about? So I think one of the good things about the LinkedIn Live format is we also get to engage more. So if there are any questions or any opinions that you want to share throughout the duration, please do use the comments functionality.
Yeah. Thanks for setting the context, Chunky. I believe we'll just give a couple of more minutes for other people to join. We'd love to hear from them where they are joining from. And as Chunky mentioned, are there specific areas you would want us to talk more about? If you have any questions for us, would love to keep it more interactive and hear from you in the comment section.
So, Priya, maybe just to also set some context, right? So, this is an area where, again, the two of us have had a number of conversations, I think, between us, between the team at Everest Group, and also externally. Uh, and I think this is one of the topics that, again, comes across I would say most often in our interactions, and particularly in the last couple of years is when I've seen this increase. Uh, and again, we've used a lot of heavy words, right? So customer experience, hyper personalization, and I see these words used not just in healthcare but like across everything. Uh, and I think in some of the areas, right, at least like the phones that we use in retail, we've been using this for more than what, 6 7 years. So yeah, tell us more about what does this mean for healthcare, and like why are we talking about this in 2023?
Good that you asked that question, Chunky. I can't say for sure that hyper personalization is something which is happening in healthcare, but we are definitely using the same heavy word as we are using in the other industries. So I'll just start talking about what it really means when it comes to the healthcare construct. And as you mentioned, why are we really talking about it? So if you think about any other industry, say retail or banking and financial services, customers have been getting a very personalized experience. Let it be emails that they receive, the kind of communication that they receive, the portals, the applications, everything is very digitized. Healthcare as an industry was never really focused on customer experience, but this was only till a couple of years back. If you think about the present day construct, even the healthcare customers are expecting a lot more personalized experience. Now, thinking about it from an enterprise perspective, why do a payer or a provider really care about driving this personalization? So there are a lot of different reasons that have come up together, which are responsible for this hyper personalization coming in healthcare. Things such as COVID-19 making sure how customers now expect payers to work more closely with them, or customers expectations increasing because of the digitalized experience they receive from industries such as retail. And even from an enterprise perspective, them realizing how if they are able to improve the experience of the customers, they can actually make sure that the retention of these customers is higher, and you will not have to invest a lot in acquiring these customers. So I'll take a very simple example here. Say 5 years back, mostly a payer or a provider was spending a lot of dollars in just trying to acquire new customers, whereas at the same time, your patients and members were constantly complaining that they are not receiving a personalized experience from these payers and providers. Ultimately, now the focus is not just on acquiring more customers, but also making sure that the customers who are already working with them feel cared for, get a seamless experience, let it be related to getting omni-channel experience or any other things. So this is how some of the things have changed in the healthcare construct. In fact, even till a couple of years back, calling a patient or a member a customer was really looked down upon when it came to healthcare. But now we see a lot of different things happening with the experience or the engagement of the customer really becoming a priority.
Thanks, Priya. And I think what you also mentioned, right? So it's from a healthcare perspective, there's a patient, there's a member, right? So again, where are you seeing more investments? What are you seeing from a patient experience perspective versus a member engagement perspective?
Yeah. So I think that's going to be a $1 million question for at least the platform vendors and the couple of platforms that we see in the industry. So while from an enterprise perspective or from a customer perspective, both member engagement and patient engagement are going to be very important. And I'll in some time from now I'll talk about what exactly are the common themes versus the differences in which how it happens. But just from an adoption perspective, if you think about the large healthcare hospitals or even the mid ones, they're really dependent on the niche vendors or the technology players or the service providers to help them in building out this journey, provide them with solutions for better patient engagement. Whereas if you think about the larger or the mid-sized payers, most of them are a lot more tech savvy and still want to keep all of these things in house. For example, if you think about the top 5 payers in the US healthcare construct, most of them would be building a lot of very fancy member engagement platforms in house and have all the technology tools in the world to drive the best member engagement. Fortunately or unfortunately, that's not something that we can say for the large or the mid-sized healthcare providers who are still a lot more keen on exploring the products or platforms that are available in the market. And with that, I'll also try to talk about what are some of the key tenets that we see from a patient engagement construct. So, what really defines a patient engagement construct in the present day scenario? So largely, if you look at this slide, we are talking about certain core modules and certain value differentiators from a customer engagement point, from a patient engagement point of view. So the things that you see on the left, things such as omni-channel engagement, if you think about a patient, they really want to get access to all possible kinds of engagement models. Let it be your text messages, your emails, your phone calls. Your patient doesn't really care for if you are available only via an email or if you are available only via a text option. They want you to be available across these channels, and they also want the experience to be seamlessly integrated. Now again, if you think about the retail industry or of a banking industry, this is something which has always been present. Even in the healthcare construct, I'll say omni-channel engagement is not an area which has been a big problem, and at least in the last 1 to 2 years we've seen a lot of investments still happening here. Things such as digital payment or scheduling your appointments online are again areas where the providers seem to be invested. If not the smaller ones, at least the mid-sized and larger ones seem to be invested pretty well in this area. What you see on the bottom, which is cloud enabled contact centers and AI enabled chatbots, are primarily areas where we see investments happening, but a lot of potential for growth. So, if you think about again a customer, they would really expect their healthcare providers to be present 24/7 for them, and hence using generative AI, advanced analytics, or AI related functionalities in your chatbots so that at least a large chunk of your patients get their problems resolved via this basic chatbots is going to become very important. Making sure that these contact centers are cloud enabled, there's seamless data integration, some of those things are again going to become very important. And then the other question that we always keep talking about is the value differentiators. So what are the areas wherein we keep hearing from the patients that they want to see more investments in, but we still see there's a dearth in the industry when it comes to those areas. So couple of areas related to care coordination. So if you think about the US healthcare industry, it spends crazy amount of money when it comes to healthcare. So it's approximately 16 to 18% of the GDP money going only into things related to healthcare. But if you think from a patient point of view, you will hear complaints that when I'm going to my primary care physician, they are talking about something else, but where when I'm going to say a specialist, they don't really know anything about my symptoms. So how do you make sure that the care is really coordinated between these different stakeholders is something both patients and both payers and providers need to solve for. And similarly, when it comes to things like, say, telehealth. So, telehealth, although the pandemic really blew up everyone, there are a couple of positives that it did drive into the industry. And uh, for sure, one of those is telehealth. Get directly engaged with patients, making sure that remote patient monitoring also means you can always stay in sync with your physicians and your specialists. You can get in touch with any possible specialist even if they are not really in your care zone, and even with the CMS making the reimbursement tools easier. All of this has meant that telehealth has now become a very integral part of patient engagement. Your IoTs or your wearables of the world are enabling much better remote patient monitoring. So these are some of the areas wherein we see there is a lot more differentiation that can come into the healthcare ecosystem from a patient engagement perspective. These are areas wherein the providers are where the patients are a lot more keen to see investments from the providers.
Thanks, Priya. This is a very good way to visualize this. And I think in my experience, like when I've talked to providers or when I've talked to, especially I think some of the mid-sized providers, uh, I think a lot of them have been looking at only one or two areas. So again, a lot of conversations, at least a couple of years ago, when related to experience, were largely centered around contact centers, right? Because I think that is where a lot of these investments started from. But wanted to understand from your recent conversations, where do you think payers are currently invested in? And we'll come to later on like what they still need to do. But if you look at if you look at providers currently, uh, what are they? Where are they really focusing on, or what are the things that they're really trying to do?
Sure. So I think as you, it's again a very interesting question. So if you think about where most of the dollars are still going, it would probably be in what you see on the left, things such as contact centers or AI-enabled chatbots. And while these are things which have definitely become a must-have, if you think from an investment point of view, some of the things on the right are not going to take probably a lot of investment. Things such as care coordination, or in fact, making sure that you are being very transparent with your patients. You are making sure that your patients can get seamless access to their own patient health records or price transfer. They're able to know what kind of out of pocket payments they would have to pay, or what's going to be the exact bill that would get generated, what's the payer really going to pay for versus what's it that they would have to pay on their own. So some of these functionalities, while they are not going to take as many dollars as say something like a cloud enabled contact center would take from an enterprise perspective, these are things which can make a big difference in both the short and the long term. But yeah, going to your point, where do we see maximum investments happening today? Would probably in the areas that we see on the left on this slide, which are the core modules that we've listed down here.
That really helps. And maybe a question for you, and before you answer that, maybe a question for the audience. Like if you had to choose one area, right, where healthcare, if you were a let's say heading a healthcare provider, there was one area that you could select to improve experience for your patients, like what would that be? And Priya, while some of the audience members type that a question to you, right? Uh, so the audience is, I think, entering one. So maybe the question for you is like, what would be your top three in terms of what would you advise some of the healthcare providers, knowing what knowing what they would have currently invested in, like what are the top three areas in the order of priority where you would advise them to invest?
Yeah. So I think I'll just tie it to some of the complaints that we keep hearing from our patients, which are around very basic areas that I don't get to see my own health records, which is very frustrating for a healthcare patient that they are not able to see their own health records. And I think my views also align with the comment here, which is around transparency. So transparency with respect to our own patient records, or transparency when it comes to what kind of bill I would have to pay. This I think should be one of the most important area, followed by something like definitely an AI enabled chatbots. Again, it's chatbots or cloud enabled chat contact centers is in no way something that we've not seen happening. Almost every other provider would have some kind of a contact center in place. But where we possibly see the challenge coming in, that the integration with the right data sets, or making sure that they are actually able to answer the queries for your patients, is not something that we see very often. Most of the patients would still complain that these chatbots are not able to answer their basic queries, and probably that also sets the stage for how something like a generative AI or chat GPT can come and play a big role in healthcare. And
But yeah,
finally,
no, no, sorry. I think I asked for three. Yeah, go ahead.
no, no. So, and again, the third area for me would be something which is again not going to take a lot of investments, but probably a low hanging fruit, which is something around digital payments and digital appointment scheduling. Again, most of your, and not most, I'll say all of your patients are already experiencing the kind of applications that a retail industry or a BFSI industry offers them. And we've heard it from patients that I would easily change a healthcare provider, even if they are providing me the best kind of care. If they are not providing me with these digital applications to say book an appointment or pay my bill, I'm very easily to switch my provider. So probably I'll not say that engagement has become more important than providing the actual care, but it's still at least equally important.
Yeah, and I just wanted to respond to one of the comments from Boo, right? So I think he's mentioned a couple of points. So, and I think especially the second point, right, which is around payment. So I think this is a massive area for healthcare providers. Uh, and I think not only will it help them improve experience for their patients, it also, like I've also had conversations where CFOs are looking at this as, again, way that they can uh, collect payment faster, right? Because that continues to be a massive issue. So quite clearly, right, for a lot of these areas, the business case is also not that difficult to make. So, but yeah, it's surprising that in today's day and age, uh, we're talking about, again, modes of collecting payments through digital mediums. uh, Also wanted to again touch on one of the questions that, or not questions, but one of the comments that came in a while ago from Jonathan, where he was asking about, again, the balance of trust and safety, the balance of that in healthcare, right? Especially around patients' data and preventing leaks, because again, we've seen the amount of breaches that have happened in the last couple of years, particularly the spike that happened after COVID. And again, whenever we talk about experience, we're talking about aggregating data of patients, right? So, Priya, what is your opinion on how do we balance some of the benefits for not just the health systems, but also for providers? How do we balance that with protecting patient information, with making sure that that their data is secure?
Sure. So, I'll start with hearing what we have heard from some of the health systems and payers in this respect. While at one spectrum, we keep hearing that when it comes to the healthcare construct, the data is not being, the power of data, it's not really being leveraged in the right way. There's a lot of data that keeps sitting in the EHRs. While nobody is really using it, so I'll not say no, it's not being used to its maximum potential. That's a big problem that we keep hearing in the healthcare construct, and I and Chunky will share more opinions around it. But I definitely agree that trust and safety exposure in healthcare is also becoming very important. most of your healthcare providers and even the healthcare payers, they're not investing in trust, safety, or protecting the data till the time a data leakage actually happens. So most of the providers or payers we end up talking to, they would only invest in bare minimum in this particular regard. And probably the time wherein they would increase the investments is when something when some kind of a data leakage has actually happened. So probably the regulations when it comes to the US healthcare construct or even in areas like Europe are already in place with respect to personal identifiable information, etc. But there's a lot more investment that is needed to make sure that the misuse of data, let it be for commercial purposes, for other purposes, is not happening. And finally, when it comes to data leakage, the consequences on a healthcare construct can be really negative. And hence, while it's equally important to make sure you have the right data management and data integration layers in place, it's also important that the right investments are happening when it comes to trust, safety, or security in the healthcare construct.
And since we are on the topic of trust and safety, I think there's another comment related to Chat GPT and PHI compliance from Ashutosh. And yeah, I think these days it's difficult to have a conversation without discussing Chat GPT or generative AI. Again, my perspective on this is again, Chat GPT is just one form of Gen AI. What we think would happen is, again, a lot of these, not just providers, but like even payers, life sciences companies, all of them would have their own instance. So again, they won't be using Chat GPT or any publicly available portal, because I think we've already seen some confidential information being leaked by people asking Chat GPT for questions. So yes, there's definitely I think a lot of compliance risks, but I think the way a lot of these industries would be looking to move forward is to have their own solution deployed on their own infrastructure. Priya, I don't know if there's anything else that you wanted to add on to Gen AI and PHI compliance in general.
Yeah. So, firstly, thanks Ashutosh for bringing up a very, very interesting point. Probably none of us here have an answer to it, but we can share what we are thinking about it. So, while all of us, including you and me, would be very eager to see use cases of Chat GPT or generative AI where it can help us decide the outcomes for a particular healthcare disease or design your treatment plans, we don't see that happening in the near term future for a lot of reasons. I don't think there are going to be regulations in any country which are really going to allow that to happen in the near term. But the largest use cases or where we see Chat GPT and Gen AI can really make an impact when it comes to patient engagement. And probably, so patient engagement is also very closely tied to physician engagement. If you cannot keep the physicians happy, probably they cannot keep your patients actively engaged. And hence, helping physicians in transcription of your medical records or creating nucleative summaries of your patient data, those are areas where Chat GPT can go a long way or generative AI can really help. Probably in some of the things like designing treatment plans or taking together that data and helping you understand if a particular headache needs a particular kind of treatment. Those are still not things that we see happening in the shorter term or in fact in the near term.
Yeah, that's a good point, Priya. And in fact, a lot of the use cases, as you mentioned, right, are directed as at physician, right? Because again, physician is also a very important consumer or very important stakeholder within healthcare. And I agree with you that I think we'll in like at least in the near term, I think some of the high impact use cases would be around how do we alleviate the physician burden, how do we help them help reduce some of their workloads. And there's already quite a few interesting studies being done on, again, use of generative AI, again, for responding to messages, right, where which is something that again can help physicians uh, again articulate some of their points better and also help them again respond to some of those queries faster. So I think we've talked about patient experience quite a lot, right? But there's also another important stakeholder, or if you think about it from a payer perspective, how do they look at experience for their members perspective? Obviously, a lot of these things would apply to them as well from a contact center perspective. But what are some of the nuances? How do payers look at experience for their members differently compared to payers, provide compared to providers?
So I guess thank you kind of partially answered it when you said that a lot of these things are going to remain the same. For example, things such as cloud enabled contact centers or making sure that telehealth functionality, etc., is also available. So these are things wherein the payers are also investing a lot. I think from a payer perspective, something that I'd like to really highlight is that if you think about payers, they have traditionally invested a lot in things such as sales and marketing and contact center optimization. So while sales and marketing and contact center optimization, it's definitely important. We all agree, but the change in mentality has come in from realizing the fact that again, acquisition needs to be given equal, retention needs to be given equal focus as acquisition, and hence your payers need to really start investing in things related to care management. And when I say care management, it simply means making sure that you are also investing a lot in making sure that your patient or your members are receiving the right kind of care. It could be simple things related to investing in population health management, or if a certain member is suffering from say diabetes, giving them, making sure that they are taking care of their medication, going for regular appointments, giving them wellness plans. And it has I am sure it's not going to be a surprise to anyone when we say that making sure you are doing these things directly translates to better engagement for your members, but also has another direct impact, which is bringing down the cost a lot for you in the shorter and the longer term. And this is again, the providers, it might not be an very important, the wellness solutions might not be a very important area always for the providers, but for payers, it has directly quantifiable results if it's taken care of. So probably that's an area wherein we've already started seeing payers investing a lot, but there's a lot more that can be done. Some of the other, I'll say, low hanging fruits where we've heard from members that they expect payers to be more proactive in helping them is again helping them identify the right providers. So, given a certain set of conditions and diseases that a person might have, helping them understand who would be the best provider for them given their coverage, their history, etc. And these are some of the areas wherein the providers can differentiate, and by not just investing in sales and marketing and say the contact centers wherein they already invest a lot.
And lately, we've also seen a lot of payers invest in care management, right? And that's also an area from an experience perspective. Because I think, as you were mentioning, it's not just about contact centers. It's not just about, again, it's historically a lot of it has been looked at it from member acquisition perspective. So more focused around enrollment, more focused around contact center. But care management is also an important aspect, right? So the example that you gave in terms of navigating which provider to choose. One of the areas which I've also seen is again as the population is aging, as we have more complex rare diseases where patients might uh, where a patient might be suffering from multiple diseases. Uh, Care is getting more disaggregated, so there's clearly more that payers need to do in terms of supporting their members. Is that an area where you see payers currently investing in, or is that an area where you think that they should?
Yeah. So definitely, Chunky, investing more in things related to wellness and is an area where we see a lot more appetite to invest from the payers. Some of the larger ones seem to be invested, but still those are more in pockets and silos, and a more consolidated effort in that area is still something that members expect more to happen.
And maybe a question for the audience, because we also want to hear from them and learn from them. What, from a member experience perspective, right? What do you see as the biggest challenge?
So while Probably, we hear more from the audience on some of the challenges that they see from a member engagement point of view, or an area where they don't see members investing enough in. I'll also like to bring in another key piece of the puzzle here, which is the data aspect of things. And as we said earlier, we'd like to come again on this. So, talking going back to my earlier comment on that, there is one spectrum of the data puzzle wherein we say that building a 360-degree view of the patient or the member is not something that we see happening a lot in healthcare. Part of it is because the interoperability regulation has eased some of it, but traditionally the payers and the providers did not really have a master data management layer. Or even if they had, if you think about a payer, they don't really have access to clinical data, which is a must have to drive population health management outcomes. Or if you think from a provider perspective, even if they get access to an EHR data, they do not have the important claims data that could be relevant in certain cases, or in some cases a specialist might not have all the data from a physician. Hence, bringing together all of these data to make sure you are able to build that 360-degree customer view becomes very important. And going back to some of the things we talked about telehealth, so if you think about a wearable, or if you think about how most patients today have some kind of an RPM device that they are using, it's also making sure you are using all of that social determinants of health data and wearable data to drive outcomes. I think again would be a very important part of the this puzzle.
And I think since you talked about data, right? So, uh, is all of this data something that payers would have like with themselves, or do they need to collaborate with providers, right? Because again, uh, this is also an area which becomes very important as some of the industry lines are blurring, and to be able to deliver a good experience to members, you need different types of data. So what are your views on this?
Yeah, that's again, I think, a very interesting question, and also sets the stage for another comment that we see here. So I'll probably also read the comment. So we see payer provider collaboration happening where payers are taking up time consuming operational work from providers or large practices, and your views. So I'll come to this question, but before that, I'll talk about Chunky's comment and payer provider collaboration or consolidation in general. So if you think about, so to answer your question simply, Chunky, no, we don't think that there is all the data that a payer can essentially hold. And there is a lot of it that is simply controlled by the providers because of simply how the industry operates. So the most crucial data still sits in those EHR systems. We've seen investments happening where most of these EHRs are now being embedded to the are now being cloud enabled, and in some cases there are APIs that are being built to get access to this data, but still not all of the CHR data can be seamlessly integrated with third party products. Also, from a payer perspective, there is still data that is residing in these EHRs, data that is owned by the providers, data coming in from the wearables, etc., which is important to which is important for a payer to make sure that they are able to help a patient in their population health management and care management related things. However, I would also like to put that caveat here that of course there are boundaries with respect to the PHI data, where for example there are regulations which are going to inhibit or a payer from using that data for making sure that there is no discrimination happening. And hence it's also important that because it's the healthcare construct, that those boundaries or that trust and safety is also something which is not really breached. But essentially, the collaboration between payers and providers can really ease your use cases around your prior authorization, utilization management, or in fact care management, if these providers and payers are collaborating more on for some of these solutions.
And
And I
this is
think,
a yeah, and yeah, no, I was about to say that this is a touchy subject, right? Because as you mentioned, there are a lot of developments that we've seen in the last couple of years, where again providers are working with payers, giving them access to their EHR data. And we've also seen, again, some of the providers partnering with some of the large cloud players, hyperscalers like Microsoft and Google, to to again move some of their workloads to cloud. But again, one thing I keep hearing from a lot of other product and platform players that operate in this space is that it's still extremely hard to get data from some of these EHR providers, right? So while again, we've seen more collaboration between the different ecosystem partners within this area, there's still a lot of other challenges that they need to overcome. And as I think, Priya, you mentioned, right, that to get a complete view of your member or your patient, you have to rely on data that is outside your four walls. So I think that is where this becomes even more critical. So yeah, while there's definitely a lot of good examples, but I think as an industry, there's still a long way to go in terms of enabling through collaboration.
Yeah,
Uh,
definitely. And just one, so sorry for cutting you, Janki. Just one part of this payer provider collaboration, which is also probably something which was mentioned in the comments. So, the pay wider construct is an area which we've seen since some time now, and which makes it kind of easier to drive better patient engagement or member engagement. I think it becomes trickier when these payers and providers are working as different entities in the ecosystem, because that's where not all the priorities kind of align, which kind of could mean in certain cases a negative experience for the patient or the member.
Yeah, and I think since we talked about technology, right? So maybe let's quickly turn our attention to what kind of a technology platform would enable this. Now, historically, again, we have seen payers and providers use some of the CRM systems. But again, as we were discussing before, right, a lot of these functionalities were focused on sales and marketing. But Priya, as you described, that there are a lot of other functionalities as well. What kind of a technology platform do you think would enable payers and providers to move more from relationship management towards experience?
Yeah. So, as we were talking about, it's a very important to move from just acquisition to focusing more on retention. And hence, if you think about some of the traditional CRM platforms, they were heavily focused on sales and marketing, very focused on customer acquisition. But if you really think about some of the statistics, acquiring a customer takes a lot more investment than retaining them. Hence, it's important to switch into customer experience platforms, which are going to focus on a 360-degree customer view rather than just relying on historical sales and marketing data. And when you switch really from a CRM to a CXP, it means acquiring more customers by focusing on things starting from grievances redressal to care management to driving better transparency for your end customers. And similarly, if you think about an experience platform, it's going to really think about from a payer or a provider perspective, what are all the touch points in which I get to interact with my patient or my member, and hence how do I make sure that all of those touch points get impacted. In fact, even some of the indirect touch points, if you really can't make sure that your physicians have a seamless experience, you will not be able to make sure that your patients are having a good experience, and hence the kind of transcription tools that a gen AI or a chat GPT can enable are going to become important. Hence, the focus that we see from platform vendors now is more on building these CXP platforms, which can enable personalized communication via emails, via text messages to the individual customers. And as we said earlier, what might sit at the bottom of a CXP is going to be an integrated data layer that can bring in together all of the data puzzle together.
And yeah, so I think there was a question about whether the presentational recording would be available. So the answer is yes. And one of the other things that we'll also make available is an executive summary of one of the reports that we published. And again, since like the fact that I brought it up, Priya, we've also done some research in this area where you evaluated a lot of product and platform players who are enabling payers and providers to deliver again better experience to their members, to their patients. Do you want to maybe just give a few highlights about what we learned from that particular assessment?
Sure, Chunky. So I think it's a good segue into talking about some of the learnings that we saw from this particular assessment. So if you think about some of the larger players or the customer experience focused platform players, such as whom you probably see as leaders or high major contenders on the Speak Matrix report, we've seen them heavily focused on bringing together a data management, an integrated data management layer, building in more integration with the EHRs of the world, as we just discussed, having the making sure that that integration is available with your epics and cerners of the world, to building use cases that can impact the entire value chain, be it sales and marketing, care management, or grievances redressal. All of these areas getting impacted, to the low hanging fruits, which could be things such as care collaboration, wellness plans, telehealth related. So it would be wrong to call telehealth a low hanging fruit, but an important piece of the puzzle. So if you think about some of the leaders here, they are probably focused on bringing together all of these use cases and drive a more seamless experience for your patients. We've also seen a lot of just healthcare players here, or the niche vendors here, who bring in very interesting pieces of the puzzle. It could be things like your email based communication with the patients, or driving omni channel engagement with the patients. So, some of the players, some of the niche healthcare players, we've seen them pretty focused on one area of the value chain and drive a very good engagement for the end customers there, be in it in things related to digital scheduling or billing or enabling digital payments. Some of these niche vendors are doing a great job in driving some of those use cases. And we also have another question here. So, which is Gen AI like ChatGPT HIPAA compliant? So, Mandar, I guess it's so chat G and just sharing some of my perspectives here, because this is still a very new area where all of us are discovering new things on an ongoing basis. But Gen AI in itself, so wherever there are use cases that are being built leveraging Gen AI, they'll have to become hyper compliant. If you think about any of the existing platforms in the healthcare construct that are providing use cases for driving customer engagement, they can simply start using Gen AI to drive some of those. But making sure that the platform is HIPAA compliant would still have to be done. So yes, there are going to be swim lanes there. There are going to be a number of there is going to be some ambiguity around what can and cannot be done, but the platform will still have to be made HIPAA compliant there.
Absolutely, and even the use cases that the payers and providers end up selecting, right? That is an important consideration that they have to make. So again, any use case from a healthcare perspective definitely has to be HIPAA compliant. And yeah, and again, when we're talking about Gen AI, I think it's just important to recognize that we're not talking about we're not talking about Chat GPT 3 or Chat GPT 4. We're talking about again Gen AI solutions which are dedicatedly designed for the healthcare industry. So yeah, depending on the type of use case, what kind of information would it use? I think this is one important parameter that would help payers and providers prioritize what are the use cases they want to go ahead with. So we are, yeah, we are nearing the end of like what we wanted to discuss. It, I think we still have some time, right? So if there are any questions from the audience, very happy to take them. Similarly, if there's a point of view that you want to share around what you are seeing from an experience perspective, we would also like to hear that. Okay, I think there's a question from Dr. Mandar on how can we make interoperability between EHRs. Any solutions?
So I'll just talk about some of the things that we see happening. And again, this is probably one of the toughest questions and one of the daily questions that we hear in the healthcare construct. So, if you think about some of these EHRs, a lot of them have become now cloud enabled, which is a great welcome move in the healthcare industry. So most of them now, although they might not have not all of them are going to provide third party integrations seamlessly, but still if you work with them, there is an option of creating those integration tools or building those APIs to integrate them with your solutions. That is an added investment that you'll have to do for a lot of these EHRs already, and that might not be something that is available off the shelf, but that's something that can be done now. And if you think from a technology player's perspective, we've seen a lot of investments in the last couple of months and years with these kind of things happening. So Epic bringing together Microsoft Gen AI in its EHR tools to take care of some of the workflows or physician transcription tools. I guess those are some really welcome moves in the healthcare industry, which are going to ease down the burden a lot for the physicians and make sure that you'll be able to and it also kind of symbols that you'll be able to integrate these EHRs with your solutions more in the future.
So maybe we can wait another minute for any other questions or comments before we close.
Okay, so I think this was a great conversation. And any last comments, please feel free to post. And any last comments by you, Chunky?
No, as always, I think it was good talking to you about one of the main challenges that we see in the healthcare industry. And as you mentioned, right, if the from an audience perspective, if there are more questions that you would like us to explore, please do mention those questions in the comments. This is an area where again we've started publishing, I think 2 years ago, and this is again one of the main from our research perspective. This is going to be one of the main topics that we are going to focus on, not just in 2023, but even beyond. So if there are areas where you're looking for answers, where you have questions, please do write them in the chat. uh, that would really help us also think about what are the areas we need to research on in the coming months and quarters. So there's one question around providers operating efficiency is one of the topic we didn't hear. So Priya, any quick take on that?
So I'm not entirely sure what do we mean by operating efficiency here. Are we talking about the efficiency related to the day-to-day work they are doing with respect to, say, administrative related tasks? So is that what we are referring to? Because I guess what we keep hearing is that reducing the admin related tasks of providers is a big area of investment, and it could be related to reducing staffing shortages or building tools around making prioritizing the right customers, helping your nurses understand who are the patients, in which order they should be brought in, or helping them in basic things around scheduling. So again, an area where we've seen more investments come in, probably driven by the COVID-19 pandemic. Because again, before the COVID-19 pandemic, nobody really thought of these administrative related things as a big problem. But right now, with the kind of dependency or burden that the healthcare providers have seen, we are definitely seeing more investments come into this area to ease the burden from your nurses and your physicians.
Yeah, and even if you think back to one of the slides, Priya, that you presented in terms of what are the different areas where that creates a wholesome patient experience. If you look at a lot of those areas, so again using AI in contact centers, right? That's also a business case for creating more operational efficiency. That you need less staff. Similarly, we talked about some of the Gen AI use cases more focused around alleviating patient burden. So again, a lot of those use cases, a lot of those areas are centered around operational efficiency as well. And that also continues to be a part of the business case. But generally, what we're starting to see from more mature organizations is While operational efficiency is always going to be there, they're also making a business case for some of the experience related areas has also become a little easier. But definitely, operational efficiency would also be a business case parameter for most of the things that you saw on that slide. We also have a question from Yuan. Hi, Yuan. We are hearing demands on the provider side for more ease of doing business with payers, to more efficient ways to provide health plans, requested information, prescription related interactions, etc. Also, smoother communications between plan and provider related to closing gaps in care. Great.
Yeah,
Uh,
I think. Yeah.
good, good. Yeah.
Yeah, no, I guess all of these great points. Definitely agree that from a provider perspective, things like prior authorization or utilization management, there's a lot more appetite coming in from these providers where they are relying on payers to ease some of this burden. And this actually takes me to another, some of the things that we hear about the providers more willing to get access to those payer rules more handy. So we always keep complaining about that the provider data is not easily accessible, but even the providers expect payers to make that the rules regarding prior authorization or the entire functionality or technology which is doing the prior authorization, or making sure that there's a prescription, or making sure that to make it easier to understand what are the kind of treatments available to be more easily accessible to the providers, which would help them in making the experience smoothen for the patients, but also help them in some of their claims management and revenue related activities. And which again takes us back to the earlier point we were making around collaboration between payers and providers. So if these players and providers are more collaborated, it just means a lot more smooth communication and experience for a patient. So if a payer knows all of the treatments that a patient has had in the last 10 years, all the different kinds of treatments that have been given, issues that a patient has faced, and if a payer is proactively communicating all of this to a provider, it's just easier to provide them the right kind of care and close those gaps in care.
Fantastic. Uh, yeah, so another comment from you, and great point on the prior authorization. Definitely a friction point between plans and providers. Yeah, completely agree. So I think so. Again, once again, Priya, it's been good talking to you about experience yet again, and I would also like to just thank the entire audience for their active participation. Uh, Thank you for making this LinkedIn Live event a very engaging event for us also, and I look forward to continuing the conversation with all of you beyond this LinkedIn Live as well. And just as a reminder, so the peak metrics report, the peak metrics assessment that Priya showed, we are also offering a complimentary executive summary of that. So please do access that. If you have any questions, do reach out to us. Once again, thank you, everyone. Thank you for your time. Have a nice rest of the day.
Yep. Thank you everyone for your time and for making it a very interactive discussion.